Health Insurance Explained for the 21st Century Man, a field guide to successfully navigating the American medical system, by Judson Brandeis M.D. Narrated by Judson Brandeis and Nathan Agin. Publisher's Legal Disclaimer. This audiobook presents a wide range of opinions about a variety of topics related to health and well-being, including certain ideas, treatments, and procedures that may be hazardous or illegal if undertaken without proper medical supervision. These opinions reflect the research and ideas of the author or those whose ideas the author presents, but are not intended to substitute for the services of a trained healthcare practitioner. Consult with your healthcare practitioner before engaging in any drug, diet, or exercise regimen. The author and the publisher disclaim responsibility for any adverse effects resulting directly or indirectly from the information contained in this audiobook. Dr. Brandeis's disclaimer. Humans are complex beings. A drug that works on 90% of men does not work on 10% of men. I put my heart and soul into assembling an exceptional panel of experts to provide the most up-to-date recommendations available. Medical science is constantly updating information. This audiobook reflects that state of the art when it was published. Future editions will reflect the evolution of medical research. My advice is to be an active participant in your medical care and partner with physicians and other medical professionals, as well as your family, to take the best possible care of yourself. This audiobook was written to address the common challenges that all men face. Individual issues of race, color, religion, culture, ethnicity, gender, and sexual orientation are intentionally not addressed in this audiobook. I have no expertise or advanced training in these subjects. We did our best to avoid making controversial statements about any of these issues.
Hi, I'm Dr. Judson Brandeis. I take care of men. I've been a urologist for almost 25 years and have seen thousands of men as patients, many of whom have shared with me their most personal thoughts and feelings. I've followed many of the men in my practice for 15 to 20 years and have witnessed the slow physical decline that's inevitable with age. Over that time, I too have aged. I've lost most of my hair, a portion of my muscle mass, and some of my libido. I've grown love handles, ear hair, and nose hair. And like most men in midlife, my prostate is starting to enlarge. Yet many of my patients have had it far worse than I have. At the age of 50, I discovered the use of shockwave therapy for erectile dysfunction, which then led to an interest and subspecialization in sexual medicine for men. Sitting down and talking openly and honestly with hundreds of men who've had, to varying degrees, lost their sexual function helped me understand that if men don't feel good or feel like they look good, their interest in sex and their enjoyment of life declines. Since this revelation first dawned on me, I've focused my practice on male rejuvenation, helping men to feel better, look better, and have better physical intimacy. Having seen hundreds of men over the past 3 years who had lost the capacity for sexual intimacy and delved deep into their psyches and their physical limitations, I identified a pattern. As a rule, men take pride in being capable and selfless. They give of themselves freely and willingly to their spouses, children, community, and career. They happily provide extra effort, time, money, or support without expecting anything in return. However, at a certain point, usually between the ages of 45 and 65, the vitality of youth begins to fade. These self-sacrificing men lose the energy they once had given so freely to others. They become the ones who need help, but having trained everyone around them to take from them, they don't know how to ask for help from others. These generous men begin to put on weight, lose their hair, become grumpy and exhausted, shed their muscle mass, and lose their enthusiasm for life. When I ask them what they do for fun, for themselves, there's usually an awkward silence. 20 years before,
Sample complete. Ready to continue?